Everybody knows that Haiti is the poorest country of the Western Hemisphere. It's true. With an overpopulation of 7 million of people, that's very hard. Economically, we are very, very weak, and we depend on all type of international help. That's very hard. As far as health is concerned, we are not lucky at all. When Dr. Guy David Theodore came from the States to Pignon and established a hospital. Before having the hospital, he came back in 1980 and met with a couple of people, the leaders of the town, and talked about his intention of having a hospital here.
I can say before the hospital coming here, we have many people die. So when the hospital come in, we have the best times, best people, best health. Dr. Guy lets his place in our state and come in to help my people in Haiti. That is my part also, to help my people. And I do the best I can to help my people in Pignon.
Dr. Guy Theodore grew up as a boy in Pignon, Haiti. His father was a Baptist preacher. While he was there, he saw one of his friends die. And he prayed with his father at that time that if he could, he would be a doctor and he would come back and serve his people. He then honored his commitment and went back to Haiti and started this hospital in 1983, and it has grown to what it is now, an amazing venture which only those who saw it start can possibly believe. I think it's essential that the Christian mission of Pignon can support the work that Dr. Theodore is doing there at the hospital in Pignon.
What we have here this morning is a group of women with their children. I assume there are about over 50 now, coming from the communities, and they bring their children to receive immunization. For every 1,000 children who are born between 0 to 5 years, in the country 131 of them die. But for the people that receive immunization, like in Pignon, in our program, for every 1,000 children who are born, 17 of them will die. Compare 131 against 17 per 1,000. Well, the group of the people behind me are what we call the mothers group. They are a group of women that we educate in healthcare system, how to take care of themselves, how to take care of their pregnancies, and when they deliver, how to take care of their babies, when to bring the babies to the hospital or to the rally post to get immunization, how to take care of the babies for good sanitation. And after those women get this training in healthcare system, so they can convey the same message to other women. They can pass on the message.
Dr. Carre Theodore is a very dedicated, very caring, excellent physician who has done amazing things with what she has provided in Haiti. She's trained over 600 midwives to be up to date and carrying the major responsibilities of birthing in Haiti. She has trained the mothers to breastfeed their babies so that they don't die from sepsis and infection.
All the mothers with their babies. We don't have babies in the cradle because this hospital is a friendly baby hospital. We encourage the mothers to stay with their babies and breastfeed them every so often. When you see patients in the hall with the beds laying there, that means we are really overloaded because sometimes we have many patients to come. We don't have so many beds, so many rooms. So we have to put the beds in the hall. Great benefit to have the American people come over here and work with our Haitian staff. It's good in a way that they can learn from the American people. When you have new techniques, you bring them up here, you teach them how to do things, and that's very good.
The work that we're doing at the mission in Pignon, Haiti is a combination of medical work. It is education work, working to establish scholarships, to be involved with the schools. We do evangelism, telling Bible stories through our children's program, Children's Bible School almost. I was involved on the trip to Haiti, and what happened was I said, wouldn't it be great if we did something like this with First Baptist Church of Vienna?
Well, one of the things at our church, when I came to our church, we were quite concerned about getting a missionary project in Haiti. And when we discovered that the Vienna Presbyterian Church had gone to Haiti, we thought it wise. They invited us to go in with them, and we were able to go to Pignon, Haiti, and now we've been blessed by going to Pignon, Haiti. While we do send monies to some areas, most of the areas where we do mission, we want our people to go and see and feel and touch, so that these are not those people that we're helping, but they become our friends. And I think when that kind of spirit catches the congregation, then the financial part will follow.
And that's how I make my commitment. I'm the first doctor coming from Pignon, get the training, and I come back to serve. Most importantly, it's not only I'm serving, but I think I'm creating some other disciples, training other people locally, helping me to do the works. But at the same time, we are learning from our friends and our missionary from the United States to provide the best quality of care that is possible in this area. Because we believe that when you are working for human beings, a good boss, you try to do a good job. When you are working for the Lord, then you should try to give the best of yourself. And I have the sense that this mission belongs to everybody. I don't feel more responsible than anybody else. I feel that we all Christians are pulling together to do the Lord's work. And I will be passing through life. Other people will continue the work. And the mission belongs to all Christians working for the Lord and strengthening the mission.
The Haitian people want their children educated. They want their children to be healthy. They want to see change occur in Haiti so that they don't have to live as their parents have lived. They want this in the worst way, and they are working diligently with us to make that happen.
Thanks to the missionary in the hospital, a student can find someone to sponsor him to do that. Me, for example,